I'm about to tell you something that could save your life, and it has nothing to do with a new pill, a fancy supplement, or a complicated brain game. It has to do with something joyful that many of you gave up years ago. Dancing, not professional ballroom dancing, not high-impact aerobics, just simple, regular dancing in your living room, at your senior centre, or even sitting in a chair. And here's the part that shocks most seniors. In one major study, older adults who danced regularly had a 76% lower risk of developing dementia compared with those who didn't. 76%. That is not a typo. I'm Dr. Claire Whitmore, and after 2 decades as a cardiologist, I've treated thousands of seniors whose hearts and brains were damaged not only by clogged arteries and high blood pressure, but also by something more subtle: years of understimulating, undermoving, under-challenging their brains. Again and again I see the same story. The body slows, the calendar empties, the days become predictable. The brain quietly shrinks into that small box. By the end of this video, you'll know exactly why dancing is one of the most powerful brain protective habits ever studied in seniors, what that 76% number really means, and how to start a daily or near-daily dance routine that is safe for your heart, your joints, and your balance. But I'm not going to hand you the exact routine yet, because if I do, some of you will try it once, check it off a list, and walk away. You need to understand why this matters so deeply for adults over 60 before you decide whether this becomes part of your life. Before we go on, comment below with your age and how often you move to music right now. It can be honest. 72, never. 81, sometimes at weddings. 68, line dancing once a week. I read these. I need to see where you are starting from. Let me introduce you to Walter. Walter was 79 when I first met him. Retired accountant. Lived with his wife of 55 years, Helen, in a small single-story house. On paper, he was exactly the kind of senior who should have been fine. His numbers looked reasonable. He was 5 feet 10, 182 pounds, blood pressure around 136/80, on a low-dose pill, cholesterol controlled on a statin, non-smoker, no diabetes. He took a baby aspirin, his cholesterol pill, and a blood pressure pill. His last annual checkup before I met him showed only mild memory complaints, nothing serious. His mini mental state exam was 28 out of 30, technically normal. Walter had always been a bit reserved. As a younger man, he and Helen used to go out dancing once a month. Nothing fancy, just slow dances at social events, the occasional swing at weddings. As he got into his 60s and 70s, that faded. His knees hurt a bit more. He preferred the recliner. Most mornings he would sit with his coffee, read the paper, and then settle in front of the TV. He did some crossword puzzles, watched the news, and took it easy like seniors are often told to do. "I've earned my rest," he'd say. 3 years before I met him, at age 76, his doctor noted that Walter's memory wasn't what it used to be. He misplaced his keys occasionally. He forgot a name here and there. The doctor said, "That's pretty normal for your age. Try some crossword puzzles, maybe Sudoku. Keep your brain active." No one said, "Keep your body moving. Challenge your brain with complex movement. Dance." There was no conversation about how powerful that could be. Walter took the advice seriously, in his own way. He subscribed to a puzzle magazine. He played a simple word game on his tablet, but the rest of his routine stayed flat. Long stretches in the recliner, short walks to the mailbox, church on Sundays where he sat in the same pew every week. When Helen suggested joining a local senior dance class, he waved her off. "I'll trip over my own feet. I'll look ridiculous." Over the next 2 years, the changes were subtle at first. Helen noticed that Walter began asking the same question twice. "What time are the grandkids coming?" 20 minutes later, "What time did you say they were coming?" He got lost once driving home from the grocery store, a route he'd taken for decades. When she told the doctor, he repeated, "Some memory lapses are normal in seniors. Let's just keep an eye on it." 6 months before I met him, there was a scare. Walter went out for his usual short walk around the block at 3 p.m. At 4 p.m, he wasn't back. Helen called his cell phone, no answer. At 4:30, she stepped outside and walked the route herself. No sign of him. Panic rising, she called their daughter and then 911. The police eventually found Walter 2 miles away, walking along a road near a shopping centre, looking bewildered. When the officer asked where he lived, he could only say, "Near the church with the red roof." He couldn't name the street. That episode finally triggered a neurology referral. His memory testing now showed more significant impairment. His score on the Montreal Cognitive Assessment was 21 out of 30, mild dementia, An MRI showed shrinking in the hippocampus, the part of the brain crucial for memory. His neurologist started him on a memory drug, explained the diagnosis to the family, and recommended staying mentally and socially engaged, staying physically active, and eating a heart-healthy diet. But there was no specific plan. No one said, "Walter, we need you moving, thinking, and adjusting to rhythm at the same time. We need to teach your brain to keep building new connections." No one said the word dance. Over the next year, the slide sped up. Walter became less confident leaving the house. He stopped driving. He wandered at night. Helen had to put labels on drawers and cabinets. The man who had managed complex tax returns could no longer balance a checkbook. He still did his crossword puzzles, but it was as if his world shrank to the recliner, the kitchen table, and the bedroom. Then came the crisis that landed him under my care. One evening at 6:30 p.m., Walter stood up from his recliner to go to the bathroom. He felt a bit off balance, something that had been happening more often as his activity levels dropped. Halfway down the hall, he misjudged the distance, caught his foot on the edge of a rug, and fell sideways into the wall, hitting his head. He didn't lose consciousness, but he was confused and could not get up. Helen called their daughter, who called 911. In the emergency room, his CT scan showed a small subdural bleed, a brain bleed from hitting his head. His blood pressure on arrival was 178/92, much higher than usual. Labs showed evidence of long-standing vascular injury. His MRI revealed not only the recent bleed, but also many small, older, silent strokes he'd never known about. The neurologist and I sat with Helen and their daughter to explain what we were seeing: mixed dementia, both Alzheimer-type changes and vascular changes from years of under-controlled blood pressure and low activity. Over the next months, Walter never quite came back. He could no longer be left alone safely. He forgot to turn off the stove. He tried to leave the house at night, believing he needed to go to the office. He became incontinent. Helen, at 77, tried to lift and guide a 182-pound man. She developed back pain, then depression. Eventually, he was moved to a memory care facility. The cost, the emotional burden, the grief of losing him in slow motion, it was devastating. Here's the part that still hurts to say. A large portion of this story might have been preventable. Not all of it. We cannot promise that any single habit will guarantee you never get dementia. But decades of research, including a landmark study in the New England Journal of Medicine, have shown that seniors who engage in regular, cognitively engaging physical activities, and dancing is at the top of that list, can dramatically lower their risk of developing dementia. In that particular study, seniors who danced frequently had a 76% lower risk of dementia than those who did not dance at all. 76%. Think about how different Walter's life might have been if, instead of sitting in a recliner with his puzzle, he and Helen had spent even 20 or 30 minutes, several times a week, moving their feet, turning, changing direction, remembering steps, smiling to music. I want you to take a moment now and be honest with yourself. Comment below with this format, your age, and how much dancing or movement to music you do per week. It can be 70, none, 82, chair exercise once a week, 65, line dance class on Thursdays. If you used to dance and stopped, add the word stopped. If you feel unsteady or afraid of falling, add the word afraid. So a comment might look like 78, none, stopped, afraid. This isn't about shame. It's about seeing where you are starting and then deciding if you want a different trajectory than Walter's. Let's talk about why dance is so different from simply walking or doing a crossword puzzle. Most seniors have heard that any exercise is good and that keeping your mind active matters. That's true, but incomplete. If all you do is walk slowly in a straight line and sit quietly doing puzzles, you are giving your brain and body one piece at a time. Dancing, when done safely, combines many brain-saving elements in a single activity. Think in simple images. Your brain is like a network of roads and bridges. With age, some roads narrow, some bridges weaken. High blood pressure, high cholesterol, diabetes, and smoking can fill those roads with potholes and debris. At the same time, the construction crew, your brain's ability to build new connections, called neuroplasticity, slows down. Dancing lights up this construction crew in multiple ways. First, it is aerobic movement. Your heart beats a little faster. Blood flow to your brain increases. That brings more oxygen and nutrients and stimulates growth factors like BDNF, brain-derived neurotrophic factor, which you can think of as miracle grow for brain cells. Second, dancing requires coordination. You have to time your steps, shift your weight, move your arms and legs in a pattern that activates the motor areas of your brain, the cerebellum, and deep structures that control balance. Third, Dancing with music engages rhythm and memory. Your brain has to remember the sequence of moves and stay in time. That challenges the hippocampus, the exact area that shrinks early in Alzheimer's disease. Fourth, dancing is often social. You look at another person, follow a lead, respond to a cue. Social connection itself has been shown to protect against cognitive decline. So in one joyful package, you get aerobic exercise, balance training, cognitive challenge, and social engagement. Why does this matter so much more after 60? Let me give you 4 reasons seniors are different. First, your brain reserve is smaller. Adults over 60 naturally lose some brain volume each decade. That doesn't mean you're destined for dementia, but it means you have less spare capacity to absorb damage. Activities that build new connections, like dance, are even more crucial. Second, your blood vessels are stiffer. The arteries supplying your brain and heart are less flexible. This makes you more vulnerable to tiny silent strokes. Aerobic activity like dancing, done regularly, improves blood flow and helps control blood pressure, protecting those vessels. Third, your balance and strength are more fragile. Every decade after 60, seniors lose muscle mass and balance if they are not actively working on it. Dance demands that you adjust to shifting weight, turn, and sometimes move sideways or backward. Exactly the kinds of movements that maintain balance and prevent the shuffling gait that leads to falls. Fourth, social isolation is more common. Many adults over 60 lose friends, partners, roles. Loneliness and depression are not just sad, they are toxic for the brain. Group dance classes, even informal ones at a senior centre or church, provide routine contact, smiles, touch, all of which help your brain and mood. Now let's connect this to the science. In 2003, a study published in the New England Journal of Medicine followed 469 seniors over about 5 years, looking at which leisure activities affected dementia risk. They examined reading, writing, doing crossword puzzles, playing musical instruments, playing board games, walking, swimming, and dancing. The only physical activity that significantly reduced dementia risk in that analysis was frequent dancing. Seniors who dance regularly had a 76% lower risk of developing dementia compared with those who rarely or never danced. Not 7.6%, 76%. Other research backs this up. Studies from groups in Germany and elsewhere have compared dance programs to traditional fitness programs in seniors. One trial showed that after 18 months, seniors in a dance group had increased hippocampal volume, meaning parts of their memory center actually grew, and better balance, compared with a group that did regular endurance and flexibility training without dance. Randomized studies of aerobic exercise, like brisk walking 3 times a week, have shown increased hippocampal size and improved memory in older adults. When you add music and choreographed steps, those benefits appear to be even stronger, especially for balance and multitasking. Observational studies and meta-analyses have also shown that seniors who maintain regular physical activity, including dance, have a lower risk of mild cognitive impairment and progression to dementia. This doesn't mean dancing is magic or a guarantee, but it does mean that a joyful, accessible activity many adults over 60 have written off as for young people is in fact one of the most powerful tools seniors have to protect their brains. For decades, many doctors, including some of my colleagues, have focused almost exclusively on pills. Blood pressure pills, cholesterol pills, memory pills. These are important. I prescribe them, but we now know that movement patterns and brain engagement may be as important as any prescription. For years, seniors were told, do your crossword, take your walk. That's not wrong, but it's incomplete. We now know that an activity like dancing, which forces your brain to coordinate movement, timing, memory, and social cues, reduces dementia risk in a way that passive brain games and simple walking alone do not. You may be thinking, all right, Dr. Whitmore, just tell me what to do. How much should I dance? What kind? How hard? I will give you a specific, step-by-step routine. I'm going to show you how even 10 to 15 minutes a day, most days of the week, can make a significant difference over the years. But if I dump that on you without talking about safety and individualization, some of you will overdo it, or you'll say, that sounds too hard, and do nothing. So let's build this logically. Let me be absolutely clear. You do not need to become a ballroom expert, you do not need to wear sequins, and you certainly do not need to feel embarrassed. The research suggests that what matters is consistency and engagement, not perfection. For many seniors, a realistic starting target is 10 to 15 minutes of light to moderate dancing, most days, building up over time toward a total of about 90 to 150 minutes per week, depending on your health and your doctor's guidance. That could be 3 10-minute dance blocks spread throughout the day, or a single 15 to 20-minute session. But I'm still not telling you that every senior needs to hit 150 minutes a week, because individualization matters. Your heart, your joints, your balance, your medications, and your starting fitness level all change what is safe and what is effective. Consider 3 examples. Maria is 68 with well-controlled blood pressure and cholesterol, no major joint problems, and decent balance. She walks 20 minutes most days. For her, adding a 15-minute dance routine at home 5 days a week, plus a weekly group class, is realistic and safe after a quick review with her doctor. Now think about Ernest, 83, with arthritis in both knees and a history of a minor stroke. He uses a cane outside the house and has fallen once in the past year. For him, it would be unsafe to jump straight into a fast-paced standing dance class. He might begin with 10 minutes of seated dancing to music in a sturdy chair, supervised at first, adding gentle standing steps while holding the back of the chair once his strength improves. Then there is Leela, 75, with atrial fibrillation and a history of heart failure. She gets short of breath walking uphill. For her, any new activity must be coordinated with her cardiologist, possibly with a stress test or cardiac rehab involved. Her dance might look like very light, low-impact movements to music, keeping her effort at a level where she can still talk in full sentences without gasping. So how do you design a safe, brain-protective dance routine for yourself? First, get medically cleared. At your next appointment, say to your doctor, "I want to start a regular dance routine to help my brain and heart. Is it safe for me? And are there any limits I should follow?" If you have known heart disease, severe valve problems, uncontrolled arrhythmias, advanced lung disease, or have had recent chest pain, you may need further testing before increasing activity. If you have significant balance issues, ask if you should see a physical therapist first to assess your fall risk. Never start a new intense exercise program without talking to your doctor first. Second, choose a safe environment and style. Clear a space in your home with no loose rugs or clutter. Wear supportive closed-toe shoes with non-slip soles. If your balance is not perfect, position yourself near a countertop, the back of a sturdy chair, or a wall you can touch for support. Start with simple steps, marching in place to music, side steps, gentle turns. If you like structure, choose a simple instructional video designed for seniors. If you prefer freedom, put on music from your youth, songs you naturally want to sway to, and let your body move. Third, structure a brain dance block. Think of a 10 to 15 minute session as having 3 parts. 2 to 3 minutes of warm-up, gentle marching in place, rolling your shoulders, slow weight shifts side to side. Then 6 to 10 minutes of more focused movement, for example 30 to 60 seconds of a basic step touch side to side or forward back, followed by 30 seconds of slower movement or rest, repeated several times. During this phase, add 1 or 2 brain challenges, change directions forward, backward, side, change the speed with the music, or add arm movements. Finally, 1 to 2 minutes of cool down, slow your steps, take deep breaths, stretch your calves and shoulders. Fourth, progress over time. In the first week or 2, your goal might be just 5 to 10 minutes, 3 days a week. Once that feels comfortable, add a 4th day, then a 5th. Gradually extend your sessions by a minute or 2 until you reach 15 to 20 minutes. To keep your brain challenged, don't let the routine become completely automatic. Learn a new step every few weeks. Alternate between different songs and rhythms. Try dual tasks like counting backwards by 3s while you dance, or naming a city for each letter of the alphabet as you step. This combination of physical and mental challenge is where dance shines. 5th, add a social component if you can. Group dance classes at a senior centre, community hall or church are incredibly valuable. Even simple line dancing, circle dances or basic ballroom steps provide social cues and shared laughter that you can't get alone in your living room. If you have a partner, consider setting aside 10 minutes after dinner for a slow dance in the kitchen. If you live alone, invite a neighbour or friend once a week for a dance date in your house, or join an online live class. 6th, track your progress. Every month, take a simple balance test. See how long you can stand on one foot while lightly touching a counter for safety. Note how many seconds before you have to put your foot down. Notice how your confidence walking around the house or outside changes. If you have concerns about memory, ask your doctor about brief screening tests like the Montreal Cognitive Assessment and see if you can repeat them yearly. Pay attention to mood as well. Many seniors report less anxiety and more joy after regular dance. 7th, integrate dance into a broader brain protective lifestyle. Dancing is powerful, but it works best alongside good blood pressure control, a Mediterranean-style diet rich in vegetables and healthy fats, adequate sleep, hearing correction, if you're hard of hearing, and not smoking. Think of dance as one pillar in a structure that keeps your brain resilient. Seniors often ask me, what if I have 2 left feet? I've never been good at dancing. The good news is that the studies did not require anyone to be graceful. The key is moving to music in a way that challenges you just a bit. Marching in place, gently swaying, stepping forward and back in time with a song. These all count. There are even seated dance programs where you can move your upper body, tap your feet, and follow choreographed motions from a chair. Your brain doesn't care if you look like a professional. It cares that you are engaged. What if I have arthritis or a fear of falling? Is another common question. If your knees or hips are painful, start with seated dancing. Sit on a sturdy chair, keep your feet on the floor, and move your arms, torso, and head to music. As your strength and confidence improve, you can add small standing segments while holding the back of the chair. If your balance is poor, ask your doctor about a referral to physical therapy. Therapists can design a pre-dance strengthening and balance program so that when you start moving to music, you're on safer ground. Some ask, is walking enough? Walking is excellent for your heart and is far better than sitting. I encourage it. But walking in a straight line on a familiar path is not as demanding on your brain as dancing. Dancing requires you to change direction, remember sequences, synchronize with music, and sometimes coordinate with a partner. Ideally, adults over 60 do both, regular walking and regular dancing. Another worry is, I'm already in my 80s and have some memory problems. Is it too late for dancing to help? No. While we cannot promise reversal of existing dementia, studies show that even seniors with mild cognitive impairment can maintain or sometimes improve their function with regular, cognitively engaging exercise. At the very least, you may slow the rate of decline, improve your balance, and lift your mood. Finally, I must emphasize this: dancing is not a substitute for necessary medical treatment. It is a powerful addition. Do not stop your blood pressure pills, your cholesterol medications, or any dementia medications because you start dancing. Never stop a prescribed medication without talking to your doctor first. Let me share a success story that still makes me smile. Her name is Lucille. She was 80 when her daughter brought her to see me. Lucille had always been social, but in the past year she had stopped driving, stopped going to church, and spent most days in her recliner watching old shows. Her daughter noticed she was repeating stories and misplacing items. At her primary doctor's office, a brief memory test scored 23 out of 30, mild cognitive impairment. Her MRI showed some shrinkage in the hippocampus and small vessel changes. Her blood pressure was 150/84, her cholesterol was modestly elevated, and she was 5'3", 168 pounds. When I asked Lucille what she did for fun in her 50s and 60s, her eyes lit up for the first time in our visit. We used to go dancing every Saturday night. I loved the music, but that was a long time ago. My knees aren't what they were. I'd probably fall on my face now. Her daughter sighed and said she doesn't move much at all anymore. Lucille's memory specialist had recommended medication and general brain games. I agreed those had a place, but I also saw an opportunity. We designed a plan in partnership with her neurologist and her primary doctor. They cleared her for light to moderate activity as long as she monitored her exertion and stayed near support. We started small, 10 minutes, 3 times a week of kitchen dancing to her favourite songs from the 1960s. Her daughter stood by with a hand on Lucille's elbow at first. They chose slow to mid-tempo songs and focused on simple side steps and sways. In the first 2 weeks, Lucille complained that it felt silly, but she also laughed more. By week 3, she told me on a check-in call, "I actually look forward to our little dance breaks." We gradually increased the frequency to 5 days a week, still about 10 to 15 minutes at a time. Her daughter filmed short clips to show me that Lucille was moving more confidently. At 8 weeks, something shifted. Lucille's daughter reported that her mother was getting up from the chair more often on her own, walking around the house for no reason other than to move. She had started turning on music in the afternoon. They found a local senior centre that offered a once-weekly low-impact dance class with chairs around the room for support. They went together. The first time, Lucille mostly watched and did small steps while holding a chair. By the 4th class, she was following simple line dance patterns, smiling and chatting with other seniors. 6 months after starting this routine, we repeated her basic assessments. Her blood pressure was down to 136/78, with a minor adjustment in her medication. She had lost 6 pounds without dieting. Her daughter reported fewer "where did I put that" moments and more initiative. Lucille was suggesting going to the centre instead of being persuaded. On repeat cognitive testing, her score improved from 23 to 26 out of 30. That may not seem dramatic, but in a condition where we often expect decline over 6 months, seeing improvement was remarkable. When I asked Lucille how she felt, she said, "My mind feels less foggy. I still forget things, but I feel more like myself, and I feel steady on my feet again. I walk down the hallway without grabbing the wall." She added quietly, "I thought my dancing days were over. I didn't know they might be saving what's left of my brain." I think about Walter often. I imagine a version of his life where, instead of gradually sinking into his recliner and shrinking his world, he and Helen had said yes to that senior center dance class, where his weekly routine had included learning new steps, turning to music, laughing with others, where the roads and bridges in his brain had more reinforcement. Would he still have had some memory loss? Maybe. But the odds of him developing full-blown dementia, getting lost on that walk, and ending up in a memory care unit might have been much lower. You now have the knowledge he didn't have. You understand that dancing is not just entertainment, it is one of the most effective brain protective activities ever studied in seniors, associated with a 76% lower risk of dementia in some research. You understand that your brain after 60 is more vulnerable to underuse and isolation, and that dance uniquely combines aerobic movement, balance training, cognitive challenge, and social engagement. You know that you don't need to be graceful, young, or free of all health problems to benefit. That individualization matters, and there are standing and seated options for nearly every senior. This information is power, but only if you act. Tomorrow or even today, put on one song you love from your youth and move your body for the entire song. If standing is safe, stand near a counter and sway, step and turn. If standing is not yet safe, sit tall in a chair and move your arms, shoulders and feet in time. Do it again the next day. Talk to your doctor about making this a daily prescription. Look up a beginner senior dance class at your community center, church, or online. Invite a friend, laugh, let your brain work. Before you leave, do 3 things. Subscribe if you want more direct, honest guidance about protecting your heart, brain, and independence after 60. Share this video with at least one friend or family member who has stopped dancing or who is worried about memory. You may give them a joyful tool they never knew they had. And leave a comment with one of 3 phrases. Starting today, if you're committing to adding even 5 to 10 minutes of dancing to your day, already dancing. If this confirms what you've been doing, or talking to my doctor, if you plan to discuss a safe dance routine at your next visit. Your brain is not a lost cause at 60, 70, or 80. It is waiting for you to give it the right kind of challenge and joy. Dancing can be that gift. Disclaimer: the content in this video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician regarding your medical condition. Never change your medication dosage or start a new exercise program without consulting your doctor.